Sizing and placing of the anterior mouthpiece involves measuring the width of your patient's mouth. Your patient's width will determine whether or not they're small, medium, or large on the anterior mouthpiece. The interincisal opening is not as important as the width of your patient's mouth. Once you've identified the width and the size of the mouthpiece, start by lubricating your patient's lips to enable the mouthpiece to slide in easily. Once you've done that, take your mouthpiece. Each mouthpiece is individually wrapped and guaranteed clean. Present it to your patient so they know this is the first time that it's being used. When you remove the anterior mouthpiece from the bag, please note there is a logical front and back of the mouthpiece, so make sure your orientation is correct. There is no difference between the upper and lower portion of the mouthpiece. Mount it onto your device and then spray the back to ensure that it's lubricated. Also helps in sliding it into the mouth. Fold the lip retractors in and then gently place it into one side of the cheek and then the other before adjusting the lip retractors onto the mouth to ensure that your patient is comfortable. Once you've done that, sweep it so that it's placed correctly. You'll notice that the tongue is protected and so is the throat. In the event that you need more room beyond the bi-to-bi access that it gives you naturally, you can adjust the mouthpiece by rotating it slightly one tooth distally on one side to give you more access on that side. If you want to gain access on the other side, you can then rotate it into the opposite direction to give you more access on that side too. Note that the lips are completely out, the unit is evacuating, and your patient has place for their tongue, so you don't have to worry about that. You can spray a little bit of water to help lubricate it a little bit, and then it will enable you to adjust it very easily. Placing it in, you can even pull it one tooth towards the anterior to give you even more lip retraction and more access to the anterior of the mouth. Simply sliding it back one tooth distally will then place it back inside the mouth. The Isolite provides continuous, hands-free, high-speed evacuation. Inform your patient that they can use their tongue to eliminate any fluid or debris that may pool or collect behind the mouthpiece. The mouthpiece is symmetrically bilateral, enabling you to place it either left or right, depending on your treatment area or whatever you feel comfortable with. Remember, place it into the cheek first, then the other cheek, and then gently place the lip retractors and adjust them so that your patient is comfortable. You can then also adjust it one tooth distally on this side, or do the same to gain access on the opposite ends. When you're done with your procedure, to remove it, take your air water syringe, put a little water in it, and sweep. This will help in releasing the mouthpiece, and then gently pull it out of your patient's mouth. When you're done, discard the mouthpiece.